Here's where cataract surgery gets exciting. It's not just about removing a cloudy lens, it's about choosing how you'll see the world for the rest of your life. We really want you to understand the different lens options because the option you choose is important and it's forever. When patients come to the office for a cataract surgery consultation, we have to give them a lot of information, and it can be overwhelming, the barrage of information you get. For instance, you want to know if you need cataract surgery, you want to know what to expect, you want to know what the risks are, you want to know what the day of surgery is going to be like, you want to know maybe about your other eye diseases and how cataract surgery can affect them. All this takes time, and when you leave, you may feel like a deer in the headlights. Everyone who has cataract surgery gets a new intraocular lens at the time of surgery, or they simply will not see. Understanding your lens options may take some time. You may want to revisit this video from your computer at home, or talk about it with your loved ones, or do your own research. There's no rush to decide. When you sign up for the surgery, it's probably going to be at least a couple weeks before we actually do the procedure, and you can always reach back out to us if you have questions. Monofocal lenses are lenses that see one distance, either far away, intermediate, or up close. For 50 years, this was the only option that we had for patients getting cataract surgery. These lenses can't correct astigmatism, and they only work for one focal length. For example, glasses that are for reading will only make you see well up close, but when you're driving or watching TV, you'll be very blurry, and vice versa. Insurances pay for monofocal lenses. The patient still needs glasses to read or see far away. And if they have astigmatism, they'll need glasses most of the time, or contacts to correct their astigmatism. A patient with astigmatism can get something called a toric lens and see clearly without spectacles at one distance, driving, reading, or they can get a toric trifocal, which will do more. An extended depth of focus is a lens that has a range of vision, but doesn't have all three: reading, intermediate, and distance. We call those EDOFs, extended depth of focus. To make it easier to understand, a monofocal is like a single focus camera lens. It only zooms on one distance at once and everything else is blurry. A trifocal is like having the latest smartphone with multiple lenses that handle everything from close up to panoramic. Choosing the right lens depends on your lifestyle. Do you want to read? Do you want to drive? Do you want to play golf? Use the computer, watch TV, see your smartphone, follow a recipe while cooking, all without your glasses? Then you really need to understand your options. A toric or trifocal lens is a premium upgrade. We put a lot of these in our patients because people love being spectacle free. These upgrades last the rest of your life. So if you think about how much you spend on a pair of glasses over and over and over again every couple years, think about the cost that you put into those spectacles. An EDOF lens allows you to see distance and intermediate distance well. For driving and computer, they're good, but you'll need reading glasses to see the fine print or, for instance, labels or price tags when you're shopping. Trifocals work a little differently than the trifocals that you know about if you've had a pair of progressive or trifocal lenses in your glasses. The way those work is when you look down through the lens, they get stronger for up close. So typically you have to lift your chin a little to see the computer, or look down here to read up close with your progressive bifocals on. Now, trifocal implants work entirely different. Here's an example. This is called the Odyssey trifocal. This is the Panoptix. We also implant lenses called the Envy. They're all very good lenses that offer distance, intermediate, and near. You'll notice on this that this has rings on it that are different sizes. And in the center is distance, then near, then intermediate, then distance, then near, then intermediate. So as you go out, the power changes. When you're looking at a distance target, you'll see only through the distance part of the lens. When you're looking at a near, you'll see through the near. That's how these allow you to look in one direction and see different focal lengths. This particular box, you can see these marks on the lens, and that's to correct the astigmatism. So this is a toric lens. So we spin the lens into position to line it up with the astigmatism in your eye and eliminate your astigmatism. Now, there's a new lens that's been available for about 2 years now called the LAL, or light adjustable lens. These are monofocal lenses. They are not trifocal lenses. They require adjustments after they're in your eye using a machine that emits UV light. Because the lens power can be changed after surgery by sunlight, you have to wear special glasses or goggles to avoid having the lens power changed while it's in your eye until it's eventually locked into position. So these are a little bit different, but they're monofocal lenses. Most people over 50 understand that distance is not the same power as reading. They learned when they were in their mid-40s that they had to start wearing readers or get a bifocal in their glasses. They wear bifocals, trifocals, progressives to perform multiple tasks at varying distances. They don't want to take their glasses off every time they look from their TV to their computer. Every year, trifocal lenses continue to improve their technology, just like a new model of a car. It gets better and better and continues to evolve. No IOL is like the soft, pliable human lens of a young adult that can zoom in and out and focus at any distance. At Costello Eye, we've placed thousands of premium lenses. We see the greatest satisfaction and the most functionality is with the trifocal lenses. Together in the office, we can discuss what is best for you, and you can make your own decision. If you have astigmatism, you know you just can't see right without glasses or contacts. A toric lens with or without a trifocal platform is an absolute home run for those patients. They usually tell me they've never seen that good in their entire life without their glasses or contacts. It is so rewarding as a surgeon when a patient that needed glasses their entire life, or a patient that hates putting on readers every time they look at their phone, is able to become spectacle-free after cataract surgery. In my experience, patients love these lenses, and we have put them in our own parents, aunts, uncles, and dearest friends. I've had many standard lens patients tell me they wish they realized how inconvenient it would be to constantly put readers on. At that point, it's too late. Trifocals are not for people with moderate to severe macular degeneration or diabetic retinopathy because they can have more glare and less contrast in those patients. Eye measurements and perfect lens centration in the eye on the visual axis matters. Ask your doctor how they handle complications and adjustments and lens exchanges. Also ask them how many of these type of lenses they put in. Although very rare, a surgeon with lots of experience using these lenses should be able to resolve issues like this. In my practice, I perform about 1,800 cataract surgeries a year currently. I believe a surgeon with a great deal of experience using these lenses is very important to get the best outcome. Choosing your lens is one of the most important steps and will help you pick what fits your lifestyle. In the next video, we'll look at the difference between femto laser-assisted cataract surgery and standard cataract surgery.